I'm an eye surgeon practicing in Bermuda. I have very extensive experience in ophthalmology. I've performed thousands of different kinds of eye surgery. I'm a very keen outdoor person. So I use my stopwatch to time my circuits. It was getting increasingly difficult for me to read the digits on my watch. So that's the real trigger for me to want to do something about my presbyopia. I have very mild cataracts forming, and I do have a condition called pseudoexfoliation, which means that my lens isn't very stable. Now, that increases the risk of cataract surgery because I don't have significant cataracts. It put me off having my lens removed and having an implant put in. And so I researched a bit more into it. I was very encouraged that Dan Reinstein, who developed the procedure himself, has had it done on him, and he's also done it on his associate. That really encouraged me to make more inquiries about having the laser blended vision. So I booked an appointment at the London Vision Clinic, and I was very happy with the measurements and the assessment and the counseling. And I'm undergoing eye surgery myself tomorrow. It's going to be the first time that I'm having any surgery from a surgery done on my eyes.
So let's take a look at your eyes here.
I'm very happy that I'm going through this experience. I'll be able to explain to my patients in a more sympathetic and empathetic way about what they're going to go through if they're going to have surgery.
I've known Leonard for, I think, about 20 years. We met at a conference. We knew people in common with my British training, and he trained here in the UK. We hit it off. He's a high-quality individual. So I was really excited to learn that he was interested in bringing this, which is, very advanced technology, to the middle of the Atlantic.
What I'm having tomorrow is a kind of refractive laser surgery. It's called laser blended vision, and the aim is to give me simultaneous good vision for both far and near, with very good quality vision and good stereo acuity.
So the process for evaluating a patient for laser blended vision, PRESBYOND, in order to correct for reading vision, is essentially the same thing as the process for LASIK, of which there have been tens of millions of procedures already performed around the world. So that's a very well-known system. But in addition to that, we have special testing techniques to determine if someone is a good candidate for blended vision, which involves having a slight disparity between the eyes. So how far up can you see here?
And for prints of this size is used only for special applications.
And how far down can you see there?
HCDR.
Yeah. So that's 2012 vision, one line more than fighter jet pilot. Pre-op testing is the standard LASIK testing. We want to look at the front and back surface of the cornea. We want to measure the epithelial thickness profile. We want to measure the prescription extremely accurately. We do it by several different methods so that we hone in on the exact prescription to be used. Then it's just making sure that the health of the eye is good.
So the first thing was the comfort of the room. The bed was very comfortable and the temperature was just fine, which helped to calm me down a bit. And then I found Dr. Reinstein and his nurse very engaging, so that they talked to me every step of the way, even from little things like keeping my head straight and how to position myself, and that helped. I found it very, very reassuring.
The procedure itself, from the patient's perspective, firstly, it doesn't hurt. It's the first thing that people want to know. The patient feels practically nothing, and they're lying down and looking up, and they're hearing me walking them through the procedure one step at a time. I'm telling them exactly what they need to know just before they need to know it, so that nothing surprises them. And it's just a sequence.
What you see is like a kaleidoscope. There are different rings, different colors and shapes, and sometimes you see an object that's like a tunnel. You think you're being taken through a tunnel with different colors.
And they're lying back, they're looking at the flashing light, listening to me. They wait a few minutes, it's done. That's it. And it sounds that easy. Well, it is that easy for the patient. Most patients will sit up as soon as I've finished, and I'll say, well, we're done. And they'll think that we just started. It is that simple. And of course, then the anesthetic wears off. The eyes might feel a little bit scratchy, watery, teary, but that only lasts a few hours. So we recommend patients just lie with their eyes closed for a few hours, give them drops, lubricants. Within a few hours, that sensation goes away, and then they open their eyes, and most of the fog is gone by then. And by the evening, people are reading the menu without glasses. So there's a big wow effect. So it's not only the best way of doing it, it actually also is safer, more accurate, reversible, adjustable, and it takes 10 minutes or so, and then it's healed in a few hours.
When I sat up, I could see. Before I couldn't read the biggest print on the opposite page of the near card, but I could read almost everything on the flip side, where the smaller prints were, just like that. Just as soon as I'd come off the table and sat up. So that was striking. That was really remarkable, quite amazing. And then when I was taken to the room, the nurse put some more drops in just to make sure that the eyes didn't get dry. That's one thing I need to do too. I have to put lots of drops in every 30 minutes for 3 hours with my eyes closed. So it's been about an hour now since I had the surgery, and I don't feel that anything has been done. My eyes are probably a little bit dry, but there's absolutely no discomfort at all. And I can see a lot more clearly, both for far and near. Let me try my phone and see if I can read anything. Absolutely, I can read everything without my glasses, and very clearly. So I can read this message from Google. The best features of Gmail are only available on your phone and tablet with official Gmail, very clearly. Compared to before, I couldn't read anything without my glasses. Compared to before, I'd have to take my glasses on because the prints are very small and it's instant. My brain has already adjusted, to the blended vision and switches back and forth without my even knowing that it's doing it. So it's quite remarkable.